Age doesn't turn off desire, it just asks for more care. Even after 60, the human body remains capable of intimacy, pleasure, and arousal. What truly changes is how it responds. The hormones slow down, blood circulation may not be as strong as before, and the sensitivity of nerve endings can fade slightly. But that doesn't mean pleasure is gone, it simply requires a gentler, more mindful approach. When a man reaches this stage of life, the goal is not to perform as he did in his 20s, but to understand and respect how his body now functions. Safe masturbation becomes a way to maintain connection with one's body, to keep blood flowing, and to preserve healthy sexual function well into the later years. As men age, the body becomes more delicate. The skin around the genital area thins and tissues lose some elasticity. That means what once felt stimulating may now feel rough or even painful if done carelessly. The same grip or pace that worked decades ago might lead to soreness or irritation today. It's important to remember that the penis, like every other organ, deserves gentle handling as we age. Taking time, going slowly, and allowing arousal to build naturally helps reduce friction and prevents injury. This shift isn't about losing strength, it's about gaining awareness. There's also a deeper benefit. Regular, safe stimulation keeps the pelvic muscles active and blood circulating to the penile tissue. This circulation is what prevents erectile tissue from weakening due to lack of use. Just like any muscle in the body, the sexual organs thrive when they're given attention in a healthy, moderate way. Without it, blood vessels can narrow and nerve endings become less responsive. So, gentle, consistent self-pleasure is not just about desire, it's a form of self-care, almost like exercise for your reproductive system. However, this self-care should never feel rushed. Men in their 60s and beyond often discover that arousal takes longer to build, and that's perfectly normal. The body's response time slows, and that's nothing to feel ashamed about. In fact, slowing down can make the experience more satisfying. Deep breathing, relaxing the body, and focusing on sensation rather than speed can transform self-pleasure into something rejuvenating rather than exhausting. Many older men also find that emotional connection plays a larger role now. Feeling calm, safe, and unpressured helps the body respond better. Stress, guilt, or anxiety can quickly block arousal no matter how healthy one is physically. So, creating a private, comfortable space and treating the moment with care, rather than secrecy or shame, allows both the body and mind to cooperate naturally. Ultimately, even after 60, the body is not broken or past its prime. It's wiser, slower, and more sensitive to how it's treated. Safe masturbation becomes a reminder that sexual health is not about performance, it's about respect. When a man understands that his body still responds beautifully when treated gently, he realizes that age may change the rhythm, but it never silences the music. One of the biggest concerns men face after 60 is maintaining healthy blood flow, and this is where safe masturbation plays a surprisingly important role. Erections depend entirely on circulation. When blood can't move freely through the arteries and into the penile tissue, stiffness becomes weak, short-lived, or sometimes impossible to achieve. Over time, reduced sexual activity can actually worsen this, because those tiny blood vessels that supply oxygen and nutrients to the penis start to lose their flexibility. Regular, moderate self-stimulation keeps those vessels active, ensuring that the erectile tissue stays nourished and responsive. Think of it like a form of exercise for your reproductive system. Just as walking or stretching keeps your muscles and joints strong, masturbation, when done safely, helps maintain blood vessel health and nerve sensitivity in the pelvic region. But unlike a workout at the gym, this is not about effort or endurance. It's about rhythm, relaxation, and consistency. When you engage in slow, gentle stimulation that leads to arousal and climax, your body releases nitric oxide, the same chemical responsible for widening blood vessels. This helps improve circulation not only in the penis, but also throughout the cardiovascular system. It's one of nature's simplest ways to support both heart and sexual health. However, this benefit is easily lost if done incorrectly. Excessive pressure, aggressive friction, or lack of lubrication can damage delicate tissue and reduce sensitivity over time. At this age, the skin is thinner and blood vessels are more fragile. That's why lubrication is essential. It reduces friction, prevents microtears, and allows the motion to stay smooth and comfortable. A water-based lubricant is usually best because it's gentle, non-irritating, and easy to clean. Avoid oils or products with strong chemicals as they can disrupt the natural balance of the skin. Beyond the physical side, there's also an emotional aspect. When a man masturbates safely and with patience, his body learns to relax and his blood flow naturally improves. But if he feels rushed, tense, or worried, stress hormones can restrict circulation, undoing the very benefits he's trying to achieve. That's why it's helpful to approach self-stimulation not as a mechanical act, but as a calming, mindful experience. Slow breathing, dim lighting, or even gentle music can help the body open up and the blood flow more easily. In essence, proper masturbation after 60 becomes part of a healthy lifestyle. It's not only about maintaining sexual function, but also about protecting vascular health and preventing erectile tissue atrophy. It teaches the body to stay connected, responsive, and alive. Each time blood flows freely through the pelvic area, it's a signal that the body is still functioning well, still capable of pleasure, and still deserving of care, no matter the age. One of the most overlooked aspects of safe masturbation after 60 is understanding the importance of timing and moderation. At this stage of life, the body's recovery rate slows down, blood vessels take longer to restore pressure, hormone levels fluctuate, and energy reserves aren't the same as they were at 40 or 50. This means that overdoing it can actually lead to fatigue, irritation, and even a temporary drop in libido. Many older men mistakenly believe that frequent stimulation will keep things active. But the truth is that excessive frequency can strain the prostate, desensitize nerve endings, and leave the body feeling drained instead of refreshed. Masturbation should support your body, not exhaust it. When performed too often, it can reduce the natural sensitivity of the penis, making arousal harder to achieve. It may also interfere with healthy testosterone balance and sleep cycles, especially if done late at night or repeatedly within short intervals. The key here is moderation, allowing your body enough time to recover and restore its energy. For most men over 60, 2 to 3 times per week is a comfortable rhythm. This frequency maintains circulation and hormonal activity without overloading the nervous system or the prostate. Equally important is the timing. Choosing the right time of day can make a noticeable difference. Early morning or after a relaxing bath in the evening are the best moments because your blood circulation is naturally improved and the mind is calmer. When you're relaxed, your body releases oxytocin and dopamine more efficiently, enhancing both pleasure and recovery. Rushing the process in moments of stress or fatigue, however, can backfire. It increases cortisol, the stress hormone, which constricts blood vessels and reduces erectile response. Men must also pay attention to their body's signals. If you experience pain, discomfort, or burning sensations afterward, it's a clear sign that the tissues are being overworked. The same applies if you feel unusually tired or notice a decrease in desire after frequent sessions. The body is trying to communicate its limits, and respecting those limits is part of staying healthy. Listening to your own rhythm, taking breaks, and focusing on quality rather than quantity ensures that masturbation remains a restorative act, not a draining one. Ultimately, moderation keeps your system in balance. Just as too much exercise can strain muscles, too much sexual activity can strain the reproductive system. By choosing the right frequency and time, you help your prostate stay healthy, maintain better hormonal function, and preserve sensitivity for the long term. Safe and mindful self-stimulation after 60 should leave you feeling calm, energized, and in tune with your body, never depleted. That balance is what keeps your intimate health strong and sustainable well into your later years. Another crucial aspect of safe masturbation after 60 is maintaining proper hygiene and lubrication. As men age, the skin becomes thinner, less elastic, and more prone to irritation. The natural production of body oils and moisture also decreases, which means that friction during stimulation can easily lead to tiny cuts, redness, or even infections if not handled carefully. This is why hygiene and lubrication aren't just comfort factors, they're essential for protecting sensitive skin and preventing complications that can affect long-term sexual health. Cleanliness should always come first. Before and after any intimate activity, washing the hands and genital area with warm water and mild soap helps eliminate bacteria that can cause irritation or urinary infections. For uncircumcised men, gently retracting the foreskin and cleaning underneath is important to remove any buildup of smegma, which can lead to unpleasant odors or inflammation. Neglecting hygiene increases the risk of balanitis, a painful condition involving redness and swelling of the glands, which becomes more common in older men with weaker immune systems. Keeping the area clean, dry, and well cared for ensures that every experience remains safe and comfortable. Lubrication plays an equally vital role. Natural lubrication tends to decrease with age, and dry friction can cause microtears in the skin, leading to stinging sensations or prolonged soreness. These small injuries might seem harmless but can open the door for infections and inflammation. Using a good quality, water-based lubricant helps reduce friction, allowing for smoother, more natural movements that protect the delicate tissues. Avoid products that contain alcohol, menthol, or strong fragrances as they can irritate the skin. If you prefer natural options, aloe vera gel or coconut oil can also work, provided you're not sensitive to them. Proper lubrication also enhances sensation and relaxation. When there's less friction, your body can focus more on pleasure rather than discomfort. It allows for better control, longer sessions, and an overall improved experience without strain. Moreover, it reduces stress on the prostate and pelvic muscles, helping maintain healthy blood flow to the area. For older men, this can make a significant difference in maintaining sensitivity and erectile strength. Finally, after any intimate activity, it's essential to gently clean off any lubricant residue. Warm water and mild soap are enough. Avoid using harsh chemicals or strong antiseptics, which can strip the skin's natural barrier and cause dryness. Patting the area dry with a clean towel instead of rubbing helps avoid irritation. Good hygiene and lubrication aren't just about comfort, they're about prevention. They protect against infections, preserve sensitivity, and ensure that masturbation remains a safe, healthy, and enjoyable practice even at an advanced age. Taking these small precautions creates a big difference in long-term prostate and sexual wellness. Another key point to consider when it comes to safe masturbation after 60 is paying attention to warning signs from your body and knowing when it's time to seek medical help. As men age, changes in hormones, blood flow, and nerve sensitivity can affect sexual function in different ways. While mild changes are normal, certain symptoms should never be ignored because they might indicate an underlying health problem that requires professional attention. Understanding what is normal and what isn't can help prevent small issues from becoming serious conditions. For example, if you experience persistent pain during or after masturbation, that's a clear sign that something is not right. Occasional mild discomfort can happen if you apply too much pressure or forget lubrication, but ongoing pain could mean an infection, prostate inflammation, or even a nerve problem. Likewise, if you notice swelling, redness, or an unusual discharge, it's important to consult a doctor. These could be signs of a urinary tract infection, balanitis, or a sexually transmitted infection. At 60 and beyond, the body's immune response can be slower, so early detection and treatment are crucial for faster recovery and prevention of complications. Another red flag is sudden changes in erectile function. Occasional difficulties maintaining an erection are common with age, but if this becomes frequent, it could be related to cardiovascular issues, diabetes, or low testosterone levels. These conditions affect blood circulation and nerve function, both essential for sexual performance. Urologists often emphasize that erectile problems are not just about sexual health. They can also be an early warning sign of heart disease or poor vascular health. That's why ignoring these signs or relying only on over-the-counter remedies can be risky. Instead, open communication with a healthcare professional can help identify the root cause and guide safe, effective treatment. You should also pay attention to changes in ejaculation. If you notice blood in your semen, pain during ejaculation, or a significant drop in volume, these symptoms might point to prostate issues or infections in the reproductive tract. While these changes can sometimes be temporary, they should never be overlooked. Prostate enlargement and inflammation, prostatitis, are common in older men, and regular checkups can help manage these conditions early. Finally, it's worth noting that emotional health plays a big role in sexual well-being. Anxiety, depression, or stress can reduce libido and make it difficult to enjoy sexual activity. If you find that you're losing interest in intimacy or feeling emotionally disconnected, discussing it with a doctor or therapist can help. In short, safe masturbation after 60 isn't just about physical care, it's also about awareness. Listening to your body and seeking help when needed ensures that your sexual health remains strong, functional, and fulfilling well into older age. The sixth and final key point centers on something often overlooked but incredibly powerful: the connection between sexual health and overall lifestyle. After 60, maintaining safe and satisfying sexual activity, including masturbation, depends not only on physical ability but also on how you take care of your body every single day. The truth is, your diet, sleep, exercise, and stress management all directly influence your energy levels, hormone balance, and blood circulation, the three pillars of a healthy sex life. Let's start with food. The foods you eat can either fuel your vitality or drain it completely. Diets rich in antioxidants, omega-3 fatty acids, zinc, and vitamin D support blood flow and testosterone production. Fresh fruits, vegetables, nuts, seeds, lean proteins, and especially heart-healthy fats from olive oil or fish are essential. On the other hand, processed foods, sugary snacks, and excess alcohol can cause inflammation and poor circulation, both of which negatively impact erectile function. Something as simple as adding more leafy greens, berries, or even a small cup of coffee in the morning can make a noticeable difference in energy and arousal. Next comes physical activity. Regular movement, whether it's walking, stretching, swimming, or light resistance training, helps keep your cardiovascular system strong. Remember, erections are all about blood flow, and the heart is the pump that makes it happen. Exercise also helps regulate weight and hormone levels, reducing the risk of diabetes, high blood pressure, and other conditions that can affect sexual performance. Even 30 minutes of moderate exercise 5 times a week can dramatically improve circulation and stamina. giving you a renewed sense of energy and confidence. Sleep is another crucial but often forgotten factor. Poor sleep reduces testosterone production and increases stress hormones like cortisol, which can cause fatigue, irritability, and low libido. Older adults sometimes struggle with insomnia or restless nights, but building a relaxing bedtime routine and avoiding caffeine or screens before bed can restore restful sleep and, in turn, restore natural energy and desire. Managing stress is equally important. Chronic stress floods the body with cortisol and adrenaline, which narrow blood vessels and reduce blood flow, the exact opposite of what's needed for sexual health. Meditation, deep breathing, spending time in nature, or even light yoga can lower stress levels and help maintain hormonal balance. Relaxation is not just good for your mind, it's essential for your body's ability to experience pleasure. Finally, maintaining emotional and social connections can rejuvenate your entire sense of well-being. Loneliness and depression can quietly drain vitality, while staying socially active, laughing often, and nurturing relationships keep you mentally and emotionally strong. Even self-confidence and positive mindset can affect physical performance, as the brain plays a key role in arousal and satisfaction. When you combine these habits, eating well, exercising, sleeping deeply, managing stress, and maintaining social connections, you create the ideal environment for a healthy prostate, strong blood flow, and lasting energy. Safe masturbation and satisfying intimacy after 60 aren't about chasing youth, they're about honoring your body, nurturing it daily, and giving it the tools it needs to thrive. The body responds remarkably well to care and consistency, and with the right habits, strength and vitality can return at any age.